S1 is the lobe, you know. Tricuspid and mitral valves close. S2 is the dub after lobe. Aortic, pulmonic valves close.
You know the love and dub.
Every single chamber's got a door we call valves, and when they close we hear it. From the stethoscope, be sure to use the bell.
And if I catch you flowing back my way, I'm gonna document it
as a murmur. I think that's what I'm hearing.
And that's not what we want to hear, but it's a common finding. And the murmur from the back flow of blood, oh, so shall it swell.
Now once again, murmurs are not normal. It's a whirlpool, hot tub time machine, the